in treatment. There is something you're very familiar with, medically assisted treatment. And, some people say, hey, it's not real recovery. Could you weigh in?
That stigma and concept of MAT, medically assisted therapy, and the stigma that carries with it is costing us lives.
Hey guys, super excited to be here with my friend, Dr. Byrd, Dr. Lelan Byrd. He is the director of addiction medicine at the Medical College of Georgia, former surgeon, and just an absolutely fascinating man with a passion for recovery and just a wealth of knowledge that he brings to Good Landing, continues to consult with us and helps lead our team of approximately 9 nurse practitioners and another staff physician, and just super excited to have you here today.
Well, I'm just excited to be here again, to come back to Good Landing and just feel the recovery environment that this place embodies. And when I say exciting, when I pulled into the parking lot out there, I got chill bumps. The ladies that were outside and seeing a part of recovery that you just don't get at other places. You feel something here that sets Good Landing apart as being unique. And I've tried to find another program as I've been involved in recovery in multiple states now, North Carolina, South Carolina, Georgia, and Florida. And there's no place even close to what Good Landing offers, because it offers the full gambit of recovery, where people that are looking to find a place that they can get back on their feet, to find a place that they can achieve recovery. This, in my opinion, if I had a family member, and I have had one as a family member that has come here and found recovery and is still in recovery. So I want this podcast that we're doing to people to feel that uniqueness that this place offers. When I came for the first time to Good Landing a number of years ago, when I walked in the room to be interviewed about maybe working here, I could feel it. And that has not gone away. And it is a power that has led to the growth, the exponential growth that Good Landing has achieved over the course of years, comes through that. And so those of you listening to this, if you want to know a place that you can come and find recovery in a very unique presence that's here, this is a place you need to come.
Thank you, Dr. Byrd. I appreciate that.
Well, it is. I don't say that lightly. I mean, as somebody that works in that and that's involved in recovery now in our biggest teaching hospital for medicine in at least in Georgia, and one of the biggest medical schools in the United States, we're starting to educate young doctors, first and second year med students that I lecture to and that I talk to about learning about addiction medicine, to where we have young doctors that are going to come out that know how to take care of addiction and what to do. Because when I was going to med school or training, and of course I was in surgery, but addiction was never even mentioned. Now the leading cause of death from 18 to 45-year-olds is fentanyl overdose. Last year, 100,000 died. And over 100,000. I just came from the national meeting that we had. It's called the ASAM, the American Society of Addiction Medicine. There were over 2,000 doctors that were in this meeting that were talking about recovery and different ways of detoxing. Good Landing offers the full gambit. I mean, when you come in and you may be strung out on methamphetamine or alcohol or going into withdrawal, our detox center empowers you to get through that tumultuous time and to get detoxed in a very, never is detox comfortable, but in the most comfortable way that we can do it. And they stick their toe in the water of recovery. And then we have a residential environment or an intense outpatient program environment that they can go from detox into that. So it does offer not only the detox portion, which most recovery centers don't do that. I mean, there are detox centers that get you detox, and then they may tell you to go someplace. But this incorporates that detox in a very beautiful place. It's like a ranch over near Gainesville, Georgia, and they'll come in, and then from that they can enter the residential or the IOP program here at Good Landing, and which I've been a part of all of that in the past. And I used to come here and do lectures every Thursday, the educational part. And I'll have to tell you, the people that I was talking to and having a conversation with taught me as much about addiction as any textbook I've ever read, or being in that environment that you share, and that peer support that is also a part of recovery is what's offered here. That room would have anywhere from 70 to 100 men in recovery, and then the women were the same way that I would talk with. And you could just feel them, the support within that group and the curiosity about how do we medically manage those that have conditions that are also associated with addiction. Some of them may have depression and anxiety and some underlying psychiatric problem, that we have the nurse practitioners, we have the doctors that are here to help supervise and help to take that medical management that many places just don't offer. So it is exciting to be here. How it's been put together, I think it's been divinely inspired. And that was the presence I think I felt when I entered the doors of Good Landing.
Yeah, it's really interesting to hear your perspective, and because with most treatment centers, people understand there's a medical component, but with a lot of faith-based programs, there's none.
Right.
And they're saying, hey, here's we're going to do 2 hours of Bible study in the morning, and then the rest of the day we're going to go and work, and then you're going to come home and read your Bible in the evening. And I'm not saying that there's not a certain client that responds to that, but I do appreciate a couple of things. Just the importance of medical detox and a medical presence and influence in treatment. But then also, as you being a physician, so many physicians are unapproachable. I mean, it just you can't talk to them. I don't know. It just is. A lot of times it's just a difficult experience.
Sure.
In the way that you love your team, the way that you love your people. I mean, were you always this way, or did your recovery journey?
That's a great question. I think my perspective of medicine is so old school. I mean, the way med students and young doctors in internship or residency are taught and trained now, it has depersonalized medicine to where medicine is now done through a laptop. And I've been sick myself and been on the other side of that, and had doctors that came in and were talking through their laptop to me. And it just was not, I didn't feel like they even got to know me as a person. My goodness, I mean, when I trained or was coming through, especially as a surgeon, you personalize the care. I mean, I did the history and physical. I did the hands-on portion of it, and sometimes even would wheelchair them out of the hospital. That's just not done now. I mean, and I'm trying to recapture that in my role as a faculty member at the medical college, and to bring the personalization of medicine back into it. And it can be manifest no greater than what you do in addiction. If that patient that is in front of me recognizes that I do care, and that they can have a conversation with me that they don't have with, that's awkward for them to talk about and deal with. And in my case, I mean, I share the illness that the person sitting across from me, I'm in recovery, and I can identify. I've been into recovery centers to where I felt, it was not personal, and it was not a experience that I felt I was going to be medically managed, that I was going to, it was just a place that you spent your time and acquired some kind of, in my case, temporary sobriety. Gosh almighty, I hope that in the people I train, I hope in the people that I help take care of and consult with here at Good Landing can feel that personalized portion of their care, can feel the peer support. This place is unique. One of the hard parts about a recovery program or facility is when relapses occur, they tend to occur on weekends. Weekends, your staff is, at most recovery centers, is limited. The group therapy and the personal therapy is diminished some, and that's when patients are vulnerable. This place empowers people before the weekend. I think Trey recognized that through his own history, that you need to have something that they'll recognize and empower them to make it through those more difficult times. And they have actually a recovery church here that that the patients here go to, and it's incredible. I mean, it has a spirit-based component to it that Trey brings and the people that speak bring, that I think empowers the people that are here to get through those hard times. And no other center that I'm aware of in America does that sort of thing. I mean, excuse me, Good Landing does not run away from the spiritual component that this place brings. And I think recovery is the real empowerment, at least of my own recovery, came through my understanding of my relationship with Christ. And this place does not run away from that.
So let's jump into something a little more controversial in treatment. There is something you're very familiar with, medically assisted treatment. And, some people say, hey, it's not real recovery.
Oh my goodness.
Can you weigh in?
That stigma and concept of MAT, medically assisted therapy, and the stigma that carries with it is costing us lives in America, in my opinion. And I do consider myself one of the experts on addiction medicine. I just came from that meeting I was talking about through ASAM, where 2,000 doctors were at this meeting. And what we're trying to do is eliminate that stigma that goes along with MAT, because it truly, MAT saves lives, probably more than any one drug that I have ever prescribed in my career. MAT therapy and using the drugs associated with it is saving lives. And I think that has to be a component of any real successful recovery center. What MAT therapy is that it replaces the opioid component. If they're addicted to Percocet, if they're addicted to heroin, if they're addicted to fentanyl, you can put them on a medication at the time when they go on it, but that is truly, it replaces their craving and desire to go back out to the street and use that particular drug. So when I say it saves lives, I'm not making this up. I've seen it firsthand over and over again. The complexity of it is that some of the drugs used in MAT therapy are expensive. And at that meeting, what we're addressing is how do we make recovery drugs like that are used in MAT more accessible, more affordable, more places that patients can get those medications. And of course, MAT, in my opinion, is just an integral part of any successful recovery program.
Yeah.
I can't even imagine. I wouldn't want to be affiliated with a program that couldn't offer somebody. I've just seen it firsthand. We use MAT therapy. I'm a medical director of a place called Hope House, which is down in Augusta. We have right now 112 was the census. These are women, all women in recovery. And many of them, at the last time that I was there, which was last week, they're pregnant. And you might wonder, can you use these drugs during pregnancy? Absolutely. I mean, we have pregnant women at Hope House that are finding recovery and that we're using those medications to carry them through pregnancy. And even they breastfeed on the medications. So I think the more familiar that doctors are and that can eliminate that stigma that goes along both with addiction and with MAT therapy, we're going to progress. We're going to move forward in those doctors that know and can understand addiction better. So I hope that answered your question.
Yeah, it does. I mean, you hit it head on. It's important. It saves lives. I've seen it save lives, and I appreciate the old school mindset on recovery, and people that may not understand it, of being leery of it. But at the end of the day, it saves lives, and that's what you need to know about it. And the next thing too is you being somebody in recovery, being a physician. So many people, or even though we're doing our best to remove the stigma, but a lot of high level individuals. I mean, whether it's business owners, physicians, pilots, professionals, not wanting to come to treatment in fear of what other people may think.
Oh, yeah. I look at it like addiction is a chronic illness, a progressive illness that I happen to have and that I've had treatment for. And until we can remove that, I can talk about it now. And it's the only progressive chronic disease that I know of that you compare it to diabetes or somebody that has arthritis. Over the course of time, those chronic illnesses get worse. Addiction, if you stay sober, you stay clean and sober, the treatment is sobriety. And if you acquire that, you get better. No other chronic disease that I know of that I can say that about. And that's exciting to be in the recovery business. I mean, that's what us doctors, or at least in my case, that's what I love. So it is. It's a progressive illness that if it goes untreated, it's terminal. You're going to die. Somebody that drinks themselves to death that I see all the time at the Medical College of Georgia, and people that have liver failure and cirrhosis, and that are, it's a horrible death. That's the end stages of where the disease will lead unless you can get some kind of treatment and recovery for it. We all know the fentanyl epidemic in America that's killing so many people. So it's a treatable, progressive chronic illness that we can and save more lives in doing so than any illness that I know of. So
yeah. So many people that make up our audience are either people in early recovery, or they are family members of people who are still in active addiction, and they're looking for hope.
Oh man, yeah.
And
I can remember being there and being one of those professionals that didn't want anybody to know that that I had an illness like that. And I flunked out of several recovery programs before I finally found one that got me sober. There is a horrible stigma. I take care of a lot of corporate executives that where my private practice was in Atlanta. I had many executives that were with Home Depot or with other corporations, and they didn't want anything to go in an electronic medical record. They wanted it completely private, completely paper charts, because they were so essentially paranoid about their home company finding out that they suffered from an illness. Why is addiction stigmatized like that? We don't do it with diabetes. We don't do it with arthritis, but nobody wants to go in and advertise that they're in recovery. And I think, I look at it as though I want the person that I'm talking with, the patient there, to recognize in me that I have something that hopefully they want to have, that I found recovery. If I can do it, they can. That you have found recovery, that if you can do it, the person sitting out there listening to you in your talks that you do. These counselors that are here, that many of them have found recovery themselves. When that personalized component that at least I felt when I finally found recovery, I was at a place that only had doctors in recovery, and there were airline pilots. And many of the airline pilots, it had been mandated that they go to a place of recovery. When I finally identified with it, there was a guy there that did the educational component, much like I used to do here at Good Landing. And his name was Ben Wilson. And I'm sure he doesn't mind if I use his name, but I remember at his talk, it was a real epiphany for me, because I wanted what he had. And it was like, God, if this guy can do it, I know I can do it. And that was the awakening that it was an illness, that you can find hope, that he was my hope. It was that, I was, that if he could do it, so could I. And that hope is what this place has. For those listening to this podcast, I want them to understand that this is a place of hope. It's a place you can send family members, as I have done. It has that component that many other places just don't.
Thank you. I mean, that's the litmus test. I mean, for us at Good Landing, and I'm glad that that you really talked about it. Is number one, is God pleased with the work that we're doing? That I always want to look at the program through that lens, and would I send my own kid here, and would I send family members here? And I've had 2 family members that have come through. You've sent a family member here,
Yeah.
and I think whenever we have the resources to be able to send them anywhere that we want to send them, and yet we would still send them here. Not that I was really looking for this podcast, nor was there any leading to make this some kind of commercial for Good Landing.
Yeah.
But it just says a lot about the work and
Absolutely.
and what you bring to the table. And anyway, I appreciate you so much.
It's a compassionate care that you get here, an individualized, personal group therapy, individual therapy, that I think the peer support, at least that's what I felt. And when I did I used to every Thursday either talk to the men or the women. And I told Trey earlier today, I learned more about addiction medicine from the conversations that I had from the people that were here, that you don't find in the Essentials of Addiction Medicine textbook, but you can find it in the conversation of the people that are coming in off the street, or the people that are working at Home Depot that have an addiction they don't want anybody to know about, that know what the challenges are for recovery. All of those people sitting out there in front, once you got a conversation going, they would independently let the other person talk. And it was amazing how many of the challenges of recovery, once they share them as a group, it in a sense is cathartic. It helps them to recognize that I'm not alone with this. This person has the same sort of feelings and cravings and challenges that I have. And how can I go about getting better? How can I have that peer support, aftercare, once I do graduate from Good Landing and get out to wherever it is that I'm going?
So good. We're going to go ahead and wrap it up. Dr. Byrd, thank you.
Oh my goodness.
For being on again. I also say to our audience too, if y'all have questions in the area of medicine as it relates to addiction, I will get those questions to Dr. Byrd, or perhaps it might be the framework for our next podcast that we do together, because I know there's so much more information in him, so many questions that people have in this area. And just want to say I appreciate you guys for watching, and appreciate you, Dr. Byrd, for
oh my goodness. Like I said, I'm excited about being back in this environment. I felt it the minute my car parked out there and came in the door. So, and I'd love to do it again. I know I hadn't shared my story or anything about it, but I'd be glad to do it if it does help somebody out there that happens to watch this, and to see somebody or 2 people sitting on this sofa that their lives have been changed by recovery. I'm not ashamed to tell it, and I'll be glad to do it.
Awesome.
You know?